This is the Isolite first. Now, the one thing that did change with me, and listen, I love the rhythm of an appointment. Like, I really get caught up in knowing that, like, I got the pulse of what I need to do next. It's my flow. I can always jump back in. And I had to change that a little bit. So just kind of get into that feeling. It's uncomfortable at first. You might fumble along, but I moved to half mouth treatment. So before I would kind of hit all the away surfaces, all the toward surfaces, and I had to really learn to knock out one side, even change the tech or the rhythm of the tools that I was using. So before I would do my airflow all the way over the mouth, and then I would maybe pick up a ultrasonic if I needed to. And now I was doing kind of a one step, two step, flip it to the other side, one step, two step. I would definitely say, Zyrus, you guys do a fantastic job of training upfront. When I first had my orientation with you guys, you kind of planted those seeds in my head, and that made the transition a lot easier because I had to change my grip on my ultrasonic to reach that distal of a third molar. There was a lot of little nuances that I think I would have been frustrated about if I had not had that seed planted in my head. And when it happened, I go, okay, I just have to readjust. So I definitely, commend you guys over there for the great training. Once I got used to it, what I feel is that the team now needs to understand what is happening. And this was a shift in 2020 because, yeah, I might have told my front office team, like, I'm doing this new thing. But now the conversations we are having are to prep the patient about the new things that we are doing, how we're keeping them protected, how we're keeping us protected. They might, depending on their level of the disease, Michelle might choose certain tools. One of them is a device that you probably possibly had in the doctor's side. Well, Michelle is using that now in the hygiene room. So it's very comfortable. You won't get that drowning feeling, really kind of beefs it up for me before the patient even gets to the office. And then when the patient is sitting in my chair, maybe the assistant will sit them. They're also having these same conversations. So we're all on board as a team. Now, when you do have that missing link, it does get a little hard. And I was also struggling with that because I was having to have that same conversation with the patient over and over and over again. And I was starting to find myself getting a little behind in my schedule because I was having to add this little, okay, this is what it's going to be. This is what it looks like. This is what it's going to feel like. This is why I'm doing it. And if that stuff can just happen at the front of the appointment or before the appointment even comes and we are saying it as a unit, it has made my appointments flow so much better now.